Here we are. A lot of people are afraid of the drill and sitting in that chair. Get this, about 50% of Americans do not visit the dentist on a regular basis. For many of them, it's fear that keeps them from getting dental care. That means every year, get this, about 30 to 40 million people skip a visit to the dentist.
It's a lot of halitosis, right? Dr. Roberto Monteagudo and Dr. Chris Hickson are here from Wisconsin Smiles with more on sedation dentistry. For those of you who got a little fear going on, we were talking about, you said you need a little sedation to get over the winter.
To deal with the winter, exactly.
I know. I was like, why didn't you bring a little of that gas for us to try?
Laughing gas.
After a winter like this winter, I think we all need something like that. I mean, this is just crazy.
For sure.
I'll be the first to admit, whenever I've had a procedure, a cavity, anything, I've used laughing gas. I think it's like the greatest thing when you're getting something done in your teeth to just relax, because sometimes it's not that it hurts, but that it sounds bad. Sure. You know, the drills don't always sound great. So for people like me or people out there who are afraid of a dentist chair, what is sedation dentistry and what exactly do you do?
Sedation dentistry basically is a tool that we use especially for patients that have slight anxiety or even a lot of anxiety. There are different levels of sedation. You know, you mentioned nitrous oxide, for example. That's the minimum amount of sedation that we could give in a dental office. But then we have a moderate amount of sedation. And so you've probably heard the term sedation dentistry or oral conscious sedation. That's where we use a sedative just before the patient comes in to achieve a moderate level of sedation. It's a godsend for a lot of the patients that come to our office because of the fact that it really, really relaxes them. Okay, they feel really, really good. They have little to no memory of the visit whatsoever.
Nice.
And so, and they're so relaxed now.
And people see you and they're like, "Are you my dentist?"
Yeah. Yeah, or they think they're on a beach somewhere instead, instead of Wisconsin weather.
Right.
But what we see basically is that these patients, they come in with their guard up. They've had some bad experiences in the past, and they want to have something a little bit more relaxing. So we use a drug called triazolam. It's basically a sedative, and we give it to the patient before they come in. And it's not meant to put you to sleep, but most patients, they're so relaxed, they just fall asleep in the chair.
We joked about it a little bit, but the reality is the fear that some of us have that's normal can actually cross the line into being a true phobia, where it prevents us from getting any kind of dental care, maybe until it's even an emergency. Should we feel bad about ourselves, guilty, embarrassed because we're afraid of going to the dentist?
Absolutely not. Absolutely not. And I think this is a great opportunity for those patients to be able to come in and give them a good experience. And it's amazing how many sedation patients will become non-sedation patients once you give them those good experiences.
Interesting.
So, yeah, it's definitely a life-changing procedure for them. Really gives them the self-esteem and the confidence to get that work done.
Yeah, and it's important because, the longer you go without getting that care can lead to things like a root canal or problems, teeth loss that, eventually are not replaceable. You can't just fill in. So how safe is it? People wonder, are these things safe for me to be doing?
It's extremely safe. And in the hands of somebody that has been certified to be able to do conscious sedation in Wisconsin, you do have to have certification. You have to go to certain courses and get your certification. It's very, very safe. I've in the literature, I have not heard of one case of somebody that has taken the proper steps through oral conscious sedation where a patient has there's been any harm. When patients come in, they have to be driven to the office. Somebody has to take them home. Cases where things have happened is where the patient doesn't follow the instructions. Okay.
Gotcha.
So they have to be monitored for at least 24 hours. And just taken care of. So as long as they're taken care of, they're fine.
What do you find, because people put off dental care, and there's so much information out there about how important dental care is even to our heart health.
Absolutely.
For pregnant women who need to have dental care. I mean, there are serious implications or risks if you don't get the dental care that you need. So for you, you want people's teeth to look nice and white and things like that. But if you're able to get someone who's afraid or has a phobia of seeing the dentist in for the care that they need, how does that feel?
Yeah, it's a very rewarding process, absolutely. And it's also rewarding for the patients as well. Like I said earlier, you know, it gives them that confidence, that self-esteem has risen, you know, go out to get better jobs, things like that. You know, the other thing that sedation is designed for too is the busy people. Those people who may have a bunch of work that needs to be done, but only want to take one day off of work, and they can get all of those procedures accomplished in one visit.
Like what? Like what kinds of things can you do in one visit?
You can do everything there is to need to do. You can do root canals, crowns, bridges, extractions, anything. Any treatment that patient needs.
Well, I was thinking about,
Cleanings.
I was thinking about the fact that I felt like my OBGYN liked me more after I had the epidural. When I was a little bit more out of pain and a little bit more relaxed.
Yeah.
I'm sure for you guys too, it's easier to work on someone who feels more relaxed and comfortable.
It is. It's a lot easier. I mean, having somebody in the chair and they're fidgeting, they're moving around, it's very, very difficult. And we work in a very small environment. So having those patients relaxed and just almost to the point that they're falling asleep, it's great. It's great for us. And most importantly, it's great for the patient also.
That's great. Well, we'll give the information so people can connect with you. Don't be ashamed or embarrassed if you haven't been to the doctor in a while, or if you're afraid. Often they can help you with that sedation dentistry. You can visit WisconsinSmiles.com. Right now there's a free consultation, which is a $150 value if you call Wisconsin Smiles. Here's the phone number. It's 414-982-3676. Feel free to ask for Dr. Hickson or Dr. Monteagudo and ask them more about sedation dentistry. Get the laughing gas.
So you can have a Gudo experience.
Yes, exactly.
Thanks, you guys.
Thank you very much.
Nice to have you on the show.